Hello friends, welcome to Easy Nurse, where nursing education made easy. So welcome back to our last session of our PBBSC exam live. So in this session we were going to discuss about mental health nursing. So previously we have already discussed other subjects. I will be explaining the last subject here today, and remember guys, whatever you have prepared, okay, be focused on that. Okay, and try to revise it again and again. So mental health nursing, it's kind of bit difficult for some people, okay, but once you will understand the core concept of the mental health nursing, you will not be able to forget it. Okay, it's something you should not do it by like by heart. You should not remember, but try to understand the topics of mental health nursing, because it's all about the psychology. So in this session, I'll be discussing some of the major topics and how much is possible, and other which are the very important topics that I have shortlisted from the other years. Okay, I have shortlisted from last 5 years, which are the most important question that have came in exam and that are intended to come in this exam as well. Okay, I have enlisted that. So in the ending of the session I will be discussing that also. Okay, I will be giving what are common suggestions which can definitely come in your exams. Okay, so you don't have to go through all of your notes, or you don't have to search everywhere in the YouTube. You can just see this live video and prepare for your exam. So further any delay, we will jump into the video. So what is mental health nursing? Mental health nursing is actually the study of the nursing students regarding the mental health, okay, health status of a person's mentality. Okay, so in this exam also the question pattern will be same as others, such as there will be 3 types of questions: long essay, short essay and short answer type questions. So long essay will be 10 marks for each. There will be 2 long essay. Short essay will be 5 marks each, and there will be 7 short essays they will ask in the exam, and there will be short answer question which will contain 2 marks for each of the answer, and there will be 10 of that questions. Okay, so there will be total 75 marks. Okay, 75 marks. First 20, 2 10 marks question, 7 5 marks question, and 2 marks question 10. Okay, so total 75. So first we will discuss about some long essays. Okay, some of the questions that we are going to discuss. So our first long essay question is: describe the classification of mental disorder according to ICD-10 and DSM-5 with examples. Okay, so here we have short questions and short answer questions. So if we see the ICD classification or DSM-5 classification, DSM-5 classification is actually diagnostic and statistical manual of the mental disorders. Okay, so based on this only, actually the mental disorders and the mental problem have been divided regarding their symptoms and how we can diagnose them. Okay, so as per the diagnostic and statistical manual of mental disorder, article number 5, it have been decided into many types. Okay, first is neurodevelopmental disorder, example as autism, ADHD, then schizophrenia schizophrenia spectrum and any other psychotic disorder, bipolar and related disorder, depressive disorder, anxiety disorder, obsessive compulsive disorder or OCD and their related disorders, trauma and stressor related disorder, somatic symptoms disorder, feeding and eating disorder, personality disorder, and substance related addictive disorders. So now see, whenever this question will come, okay, and this is a very important question, I will tell you, at least for 2 to 10 marks anything can come. For last 5 years, if you see, I think 2022 or 21 this question have came. It can come again. It's a very important questions. Okay, So in this, whenever this question have been asked, what you can answer? First, you have to tell what is mean by diagnostic and statistical manual disorder classification. Okay, what is the procedure and what are the types? Now after list out all of this type, you have to explain each of the types. Okay, we will discuss it later. Okay, so the next is various therapies used in psychiatric care, and such as psychotherapy, behavior therapy and occupational therapy. See, in the previous question you guys already know what are the what is the meaning of those disorders. If you don't see this kind, if you don't know what is those things, you can go in the Easy Nurse app and you can download the app and see the videos. Okay, this is just an reference. Okay, whenever you will read, try to read it properly. Okay, and try to give explanation of each of the disorders. So next question is, explain the various therapies used in psychiatric care, such as psychotherapy, behavioral therapy and occupational therapy. We will discuss it briefly because this question have came 2 to 3 times and many of the students of mine have complained, ma'am, I was not able to give the answer properly because I didn't know, I just only know what is the definition, that's it I have written, maybe the evaluator didn't give the marks properly. Okay, so I'll explain it in detail. So psychiatric therapies, okay, or psychiatric care, okay, this is come under a whole different version of than other therapies, okay, or other procedure or other patient care. So a planned professional interaction between the therapist and a patient to resolve their emotional and psychological problem is considered as therapy. So in a profession of therapist, when a therapist, the professional therapist is giving the therapy to the patient, and in the therapy what he is doing or what she is doing, she is trying to resolve the problem of the patient's mental and psychological way. Okay, so this have 3 types, which is individual therapy, group therapy and family therapy. In most of the severe cases we need individual therapy, okay, especially for substance disorders, OCD, ADHD, OCD problem, and the post-traumatic syndrome disorder. This kind of thing we will try to do in individual. So individual therapy is actually a one-to-one discussion. There will be one patient and one therapist. Okay, no outer side of member or third party can enter inside the conversation. Next is the group therapy. So what is that? Group therapy is actually a small group of discussion and share the experience. So what we can do here, if I am a therapist and I want to do group therapy, what I can do, no matter it's psychotherapy, behavioral therapy or occupational therapy, if I want to give a group therapy, okay, so according to the category they have psychological problem. So based on their psychological problem, I will create different groups, and based on the group's problem, I will try to discuss with them, try to resolve with their problem. Okay, so that is group therapy. Come to the next one is family therapy, which is improve the family relationship. How we can improve the family relationship? We will explain the relationship in between. We will try to find out the problems, the minute inconvenience in between them, the conflict, what is the reason, okay, and try to fade those things one by one so that the relationship will be strong. Okay, so these are the three types of therapy. Now, based on the therapy, based on the actual need of the patient, there are behavior therapy, occupational therapy, all. So first we will discuss about behavior therapy. So what is mean by behavior therapy? Behavior therapy is actually based on the learning theory. Okay, it modifies the maladaptive behavior. I will say I will give you an example. A children is growing in a very chaotic family. Okay, every time the family members will be fighting, their parents will be fighting, or maybe the area they are living, all of the children, all of their peer groups and all, or all of their friends what they are doing trying to influence them in an aggressive manner, they're torturing them or they're bullying them. In that kind of cases, a child will grow with an aggressive behavior, with anxiety. So this is kind of a behavioral problem. Okay, when the person will be not able to adapt with the situation, okay, and they will catch that energy from others, okay, and they will try to behave like them, okay, who was trying to bully them. So that is kind of behavioral problem. Now, based on this theory, what we will do, we will try to recover their adaptive behavior, or we will try to modify their maladaptive behavior. Okay, so there are technique. First one is systematic desensitization, especially for phobias. Okay, like you can say different kind of phobias from phobia in the sense the the fear of something, okay, like tyrophobia, okay. Then different types of things are there, okay. Some patients are very scared from fire, some are from deep ocean, some are from height, okay. This is a systematic desensitization. Just give me one second. So what we were discussing, systematic desensitization for phobias. So now, as we understand, it is actually what will happen in this. So in this, it is a type of exposure that therapy that will gradually helps a person overcome a phobia, and it will be combining the relaxation technique with the hierarchy of fears. Now I will say as an explanation, a children is feared from the image of jokers, okay, or a children is very, he will be very anxious when he will see a joker. So what we will first start from the hierarchy. We will set a goal, and according to that, each week or each session of our therapy, we will show them one picture of joker, okay. Just for an example, we will picture of a joker from the cartoonistic image towards the real one, okay. And lastly, in the last stage, we will try to show the real joker picture, okay. So what will happen once he is getting exposed step by step, and the increasing of the reality, what will happen, the exposure will help him to endure the fear, and he will slowly try to reduce the fear, okay. So this is we will list a different type of situation that is related to phobia is created, and order from that one causes at the least anxiety of the other causes the most, okay. For example, a fear of spider might start with a drawing of spider and end up with holding a spider. So first we will tell the child, okay, draw a spider. He will be grossed out, he will be very anxious, okay. But as he or she will start doing that, at the last stage, what it will be, he'll be holding a spider but still not scared, okay. So this is a systematic desensitization, okay. Our next is aversion therapy for addiction, okay. So what is that? Aversion therapy. So what is aversion therapy? So what is aversion therapy? So aversion therapy is kind of a procedure or kind of a process where as a therapist what we are doing, we are giving most obvious type of application like stimuli associated with maladaptive behavior such as smoking, alcoholism has become the positive conditionate reinforce, okay, through their pairing with the pharmacological effects of nicotine or alcohol, thus help to maintain the behavior of smoking and drinking. Now what I will tell, if a person is very addicted to alcohols, okay, without taking alcohol he can't survive one day. So what we will do, we will suggest them, okay, fine, keep one day you don't from morning to evening you will, if you not drink, then I will give you one glass of wine. Okay, so what it will do, it will, first he was not able to drink only, okay, he was like because there may be family members or therapists or doctors are saying if you will drink you will die. Okay, so what we are doing as a therapist, we will give, okay, we will give you a limited period of time. If you cross this time and you can survive without alcohol, we will give you on particular amount. Okay, so this positive reinforcement, what it will do, it will push them to maintain that sanity. Okay, so that is aversion therapy for addiction. Then taken economy for reinforcement of positive behavior. So what is this? So the concept, once again, the concept is whenever a person is doing, okay, good, okay, or fulfilling the target behavior of the therapist, okay, or whatever the therapist is suggesting, if he is able to do that, or he will give a reward, in the sense, if a patient will come to me as a therapist, I can suggest the token economy. What is that? I will say, okay, if you have anger issue and you can, I will tell you some very aggressive comment, I will try to make you angry, and at that time if you can control your anger or your emotion, I will reward you, okay, with this thing. So that is the token economy for any enforcement of positive behavior. Last is modeling. Okay, what is modeling? Modeling in the sense learning through observation. However, I will say, if a baby, okay, is very irritating continuously, he will be, try to mock everyone or bullying everyone. What we can say, we can set an example. We can give an example of a boy on through the observation of the other boy, that the same situation is happening with the other boy also, but he is not projecting the problem with other people, or not bullying them. Okay, so through this, what the boy will learn? The boy will learn, okay, if he can do, I can do it too. So that is kind of a modeling, okay, or learning through the observation. So as a nurse, what is our role in this behavior therapy? Our role is to assist the therapist session, reinforce the desired behavior, and maintains the progress chart. Okay, in every week or in the every session, what is the progress chart of the patient we have to maintain it. So this is about the behavior therapy, and these are the techniques. Next is occupational therapy. Now occupational therapy is very important nowadays, especially to maintain the mental health while working. So let's discuss what is the definition of occupational therapy. So it actually says it is a healthcare profession focused on helping people of all ages which is participated in daily life activities by improving their ability to live independently. However, I will say this occupational therapy involves the purposeful activities to promote the rehabilitation and self-esteem. Okay. So let's discuss why occupational therapy is needed. So if we see closely, occupational therapy is needed to help the people for all the ages to develop in their career, to recover and maintain the daily living skill, and maintaining the meaningful activities or doing meaningful activities. Especially we can give occupational therapy for the persons who came from war and all. Okay, then we can restore the independence in daily activities, aiding the recovery from the injury or illness. Okay, especially the fighters, soldiers and all, or doctors. So the main goal of us is, as occupational therapists, our main goal is to improve the concentration and coordination, develop the social and work skill, and encourage the independence of a person to aim any kind of work alone. Okay, so as a nurse, what we can do, we can motivate the persons to participate in the therapy, observe the behavior while they are doing their activities, and report the progress. Okay, so these are the types of therapy. Next is anxiety and their types. So what is anxiety? Anxiety is a vague, uneasy feeling of fear or apprehension accompanied with physical symptoms and tension. See, sometimes anxiety, if it is a very minor incident also, if a person is very sensitive to that, or if a person's mentally not stable, okay, or the person is overly panicked, at that time they can experience anxiety. Okay, so it is a vague, uneasy feeling of fear of apprehension accompanied by physical symptoms. So what are the physical symptoms? Physical symptoms include mild anxiety, include the enhance of alertness. Moderate anxiety will limit the focus and the concentration. Severe anxiety will interfere with the functioning, and panic anxiety will cause the loss of control and disorganization. Okay, so these are the types, or you can say the stages of anxiety: mild, moderate, severe, and panic anxiety. Okay, come to the next one, anxiety disorders. Okay, it have different disorders. Okay, anxiety have divided into different disorders, which are generalized anxiety disorder, this is the most common one, panic disorder, phobic disorder, and obsessive compulsive disorder. You may have heard this also. Okay, obsessive compulsive disorder. So let's see what is mean by obsessive compulsive disorder. So this is actually a mental health condition that is characterized by recurrent unwanted thoughts. Okay, how, as I explained, the mostly people know that for the OCD persons, okay, the persons who are who are already affected by the OCD, what will happen, there will be something, okay, if it is a very minor thing also, if it is a minor for their favor also, it will keep triggering their mind. Okay, and they will try to fix it, and that repeated thoughts will come again and again for a longer period of time. Okay, so they will do the repetitive behaviors or mental acts that the person feels driven to perform to reduce the anxiety which is coming from that particular trigger. Now, as an example, I can say, if I am a OCD person, okay, I am affected with OCD. Now you can say, okay, it is always related to arranging things, keeping things perfectly, maintaining clean. No, it's not. It can not come only through the physical things, it can come into the emotional things also. As I can explain, if one of my friend, okay, with her I have got some issue, okay, the clarification was not there, and she suddenly stopped talking to me. It's a very minor thing, maybe tomorrow she can talk, but I will keep thinking about this, and her not talking to me will continuously trigger my anxiety. And because of the anxiety, what I can do, this anxiety will leads me to do a mental act, a particular act or particular behavior. I will keep calling her, I will keep messaging her, okay, so to understand why she is not doing this. So this is the kind of, this is just an example. Okay, so that is OCD. So now, what are the clinical features of the anxiety disorder? For the clinical features, for mainly symptoms, you can see for the patient who has anxiety, their palpitations, sweating, tremors and insomnia. Okay, especially the person with higher anxiety and all, they experience severe insomnia. Sometimes the anti-anxiety pills, they contain some amount of sedative, so the patient can sleep and reduce their thought processing. Okay, so these are the physical clinical features. Come to the psychological one. They always face the fear, restlessness, poor concentration and irritability. They will be easily irritated with minor inconvenience. Okay, so as a nurse, how we will take care of this kind of patients? Excuse me. Okay, so as a nurse, what we can do, we can build the trust and provide the reassurance again and again. We can maintain the calm, supportive environment to reduce their triggers and stress. Teach the relaxation and breathing exercise whenever they will feel the anxiety. Administer anti-anxiolytic drug, example as benzodiazepine. This is the best drug for anxiety, the patients with anxiety as prescribed. And encourage the verbalization of fear and coping skill development. Okay, so as a nurse, we can do these things. Next is discuss the role of a nurse in community mental health programs in India. Okay, so first let's see what is the history of mental health program in India. Okay, so mental health program in India has been first developed in through the Indian Lunacy Act 1912. Okay, this short question can come in your exam, which is Indian Lunacy Act 1912. So the Indian Lunacy Act 1912 was the primary legal framework which focused on the confinement of public orders rather than therapeutic treatment of the patient. Right, okay. And in the War Committee report in 1946, this critical pre-independence report highlighted the extremely unsatisfactory condition of mental health facilities, okay, which leads to the mental health program in India. Okay, so the national, according to the modern era, right, based on the approach of digital innovation, the National Mental Health Policy 2014 aims, okay, to prove the mental health, prevent the mental illness and ensure the socio-economic inclusion of person with mental illness within a rights or based framework. Okay, so it have been developed by this process. Now, what are the roles I have discussed? First of all, to prevent and promote. Preventive and promotive role. So as a nurse, how we can prevent and promote the mental health of the patient? First of all, we have to conduct health education on stress management and mental well-being. While we are giving the care in a community or in a hospital setup also, we can do that. Okay, we can educate the patient on what is stress, how you can cope up with stress. Okay, what is mental well-being, why mental well-being can also influence the overall health. Okay, so that will be come under the mental health. Okay, and it will also promote the early identification and prevention of mental illness. See, continuous anxiety or continuous any kind of problem of mental disorders, okay, if it will be treated from the first, what it can do, it can reduce the risk of chronic situations, okay, or situation that can be handled. So before giving any kind of drug, if it is possible to give the care through the therapy and all, okay, we can do it. That means we can reduce the number, or we can reduce the patient Okay, so what we have to do, we have to promote the early identification and prevention of mental health. So for that we can go for survey in communities, especially in the occupational area, different office and different big framework structures and all. We can go, we can ask the employee, we can do a health assessment for them. Okay, it will help us to early identify of the problem. Next is organize school and workplace mental health program. Okay, in the workplace and also in the school also it is very much needed. Next is curative role. So as a nurse, how we can work as that? So we have to identify and refer patient in psychiatric treatment. First of all, we have to know about the particular mental health disorder or issue, and we have to refer patient if we can identify. Okay, we can go through diagnostic procedure and we can give the proper referral, and through that the patient will receive the psychiatric treatment. We can also provide the follow-up and care medication supervision after giving the care, and participate in crisis intervention of the patient. Okay, so here you can ask, what is mean by crisis intervention in mental health nursing? Okay, so crisis intervention is very important question. Again, I will just give you an example. So crisis intervention in actually community mental health nursing is referred to the immediate short-term emergency support provided by the nurses and interdisciplinary teams to individual families or communities. It can be because they can get the trauma, or they can get the crisis due to any kind of natural or man-made disaster, or maybe sudden economic crisis. Okay, this kind of thing. So this is the curative role of the nurse. Next is rehabilitative role. So as a nurse, we can provide the rehabilitation also by giving the support of vocational rehabilitation and social reintegration. Okay, reintegration, and organize the self-help group and family counseling. Okay, so not only if a person is need the rehabilitation, okay, rehabilitation especially for alcoholism, or maybe the suicidal tendency persons. Okay, for them if we give the rehabilitation, we also have to give some health education to the families. Okay, how to take care, how to understand the symptoms and all. Okay, how to understand their tendency. Okay, these things we will give. Next is administrative role. So as an administrative role, we have to participate in the national mental health program and maintain the records and participate in community surveys. Next is collaborative role. So as a mental health nurse, we have to work with PHC, primary healthcare centers, NGOs, community leaders for awareness and rehabilitation. The next question is, describe the types of schizophrenia and nursing care. So these are the short essay questions. Okay, so schizophrenia. What is mean by schizophrenia? So if we have to understand, see, if your brain have different parts, okay, and that different parts having a completely different world of thinking, we can call it as schizophrenia. So it is actually a chronic severe brain disorder that affects how a person thinks, feels and behaves. Okay, so the main key symptoms of the schizophrenia will be positive symptoms, which are hallucinating, delusion, disorganized thinking, speech, okay, disorganized or abnormal motor behaviors. And the negative symptoms are lack of emotion, lack of motivation, social withdrawal, loss of interest, pleasure. Okay, these are the main symptoms of schizophrenia. Now there are types. Okay, which are the types? Paranoid, catanoid, disorganized, undifferentiated and residual type. First is paranoid. What is that? It is dominated by delusion or persecution of grandeur or auditory hallucination. So the person with this schizophrenia, what will happen? They will keep thinking, they will keep imagining a person who will be whispering in their ear, or they can see them also. Okay, sometimes That is paranoid type. Come to the next one, which is catatonic. This is characterized by disturbance in motor activity such as rigidity, stupor and excitement. Okay, so this is characterized by disturbance in motor activity, which is rigidity, stupor and excitement. So what is mean by rigidity? Rigidity is actually the abnormal stiffness of muscle. Sometimes what happens, no, patient will be completely stiff, or their particular one muscle, they can't twist their head, they can't move their head or hand or leg. Okay, that is rigidity. And stupor is suddenly there will be activeness or tremor. And excitement, okay, suddenly they will be very active in a particular thing. So this is come under all catatonic type. Next is disorganized type, which is hebephrenic. This type is marked by disorganized speech, behavior and inappropriate affect. Okay, there the person will be behaving completely different. Then undifferentiated type, the symptoms do not clearly fit into any other categories. It's kind of, similar to all of the schizophrenia. And residual type, which have a past history of schizophrenia but without active symptoms presently. Okay, so these are the types of schizophrenia. Now as a nurse, how we can take care of them? We can take care of them through the established rapport. What is that? Use therapeutic communication and maintain a calm, non-threatening manner. Okay, so whatever we have to ask, if we are doing an interview, okay, and that kind of cases also we have to pick questions which will not trigger the person or which will not threat the person calmness, and we have to do it in a very calm place, very soothing place. Okay, and we have to maintain the therapeutic communication principles. Next is ensure the safety. Okay, so especially for the schizophrenic patients, they will be very harmful towards themselves. Okay, so we have to protect from self harm or aggression. Medication administration, for this we have to give the antipsychotic prescribed and monitor for the side effect. Reality orientation, we do not argue with the delusions, we gently orient to reality. Okay, so if a person is continuously thinking, he only like a imaginary person or someone have told something in their ears or they can hurt, okay, what we can do, we can tell, okay, fine, this one, like, okay, you have to listen to it first. After listening, you have to calmly reject. Okay, you have to calmly tell them the reality of the thing. Okay, so that reality orientation. Then promote the self-care. We have to assist in hygiene and daily living activities. And lastly, for the family education, we have to teach about the illness, drug adherence and relapse the prevention. Okay, so this is the nursing care for schizophrenic patient. Next is explain the classification of psychotropic drugs and their side effects. Okay, so what are the mean of psychotropic drugs? So psychotropic drug actually mean the chemical substances that primarily affect the brain and the central nervous system, causing change a person mood, behavior, awareness, thought, feelings. Okay, so this is called as psychotropic drug. There are different classification, which is antipsychotic, antidepressant, mood stabilizer, anxiolytics, hypnotic, sedatives and central nervous system stimulants. Okay, first one is antipsychotic drug. So what is antipsychotic drug? Antipsychotic drugs are the class of psychiatric medication which is primarily used to treat the symptoms of the psychosis. Okay, example as chloromazine, haloperidol. Side effects include EPS, dry mouth and water gain. The next type is antidepressant drugs. So what are these? These drugs are the class of drugs which helps to relieve the symptoms of mental health conditions such as depression and anxiety, okay, by adjusting the level of natural chemicals which is called as neurotransmitter, okay, which will be sending the signals in between the nerves. Okay, example as amitriptyline and fluoxetine. Okay, side effects include dry mouth, constipation and insomnia. The next one is mood stabilizer. So what are mood stabilizers? So mood stabilizer drugs are a class of psychotropic medication used to primarily to treat the mood disorder which will be characterized by intense or sustained mood shift. Okay, suddenly the mood will be shifted. Okay, so to stabilize that we use the mood stabilizer drug. Example as lithium carbonate, valproate. Side effects include tremors, polyuria and lithium toxicity. Okay, the next one is anxiolytic drugs. So we have already heard about it. So what is anxiolytic drugs? That helps in to stabilize the anxiety form, okay, when the patient will be having the panic anxiety or severe anxiety. Example as diazepam, lorazepam. Side effects including drowsiness and dependence of the drug. The next one is hypnotics and sedatives. So hypnotics and sedative drugs are actually some drugs which are class of the drugs that act as a central nervous system depressant. It will depress the nervous system. Okay, and with the primary difference lying in their intended usage and dosage. Okay, sedatives, what the meaning is to sedative is a substance to reduce the irritability and the excitement producing or by calming through the tranquilizer effect. Okay, whereas hypnotics are actually the form of it's a substance that's specifically designed to induce drowsiness and facilitate the onset of maintenance of sleep. Okay, hypnotics especially have given for the for sleeping purpose, and sedatives are given for the pain, okay, and to numb their central nervous system, overthinking and this. Example as zolpidem, nitrazepam. Side effects include drowsiness and tolerance. Lastly, central nervous system stimulants. So central nervous system stimulants are a class of psychoactive drug that enhance the brain activity, okay, leading to increase our alertness, attention, energy and physical activity. Especially the person who are mentally very tired, a depressed person, we usually give that. Example as methylphenidate. The side effects includes insomnia, increased heart rate. Okay, so these are the types, are the classification of the psychotropic drug. Next is describe the components and importance of mental status examination. So first, to know that we have to understand what is mean by mental status examination. So mental status examination is actually a structured assessment. It is used by the healthcare providers to evaluate a person's current mental capacity and functioning at a specific point in time. Okay, so what are the components? So we have to understand a person mental status, we will do this kind of test. Okay, so in this there are different components, which are those appearance and behavior of the person. We have to observe keenly whether they have combed their hair properly or not, whether their clothes are washed or not, how they are behaving. Okay, so that all thing we will see in the appearance and the behavior. Next is speech, how they are speaking, what is their tone, they are calm, they are very aggressive while speaking, they are loud when they are talking, they are very slowly talking or very fastly talking, whether their tone is very very loud or very low. Okay, the pitch of the speech. Okay, everything we will see under that. Then mood and effects. In every time, like in the gap of 15 to 30 minutes or a particular time period, we will see the mood swings, okay, or switching of the moods. Okay, these things we will see. Then thoughts and process of content. In a particular we will give a particular situation, and according to that, what is their thinking, or what they are thinking in their mind, or what they are feeling. Then perception, where hallucination and illusion we will talk about. Cognition, where we'll see the orientation, memory and their attention of the patient. And lastly, insight and judgment, how morally they are correct or not. Okay, so these things we will actually study under the mental health examination. Now, why it is important in a mental health nursing, why the mental status examination is important? It helps to assist in diagnosis of mental disorder. It provides the baseline for treatment evaluation. It helps in identifying the changes during the follow-up care. Okay, so not when the patient is only coming into the hospital, or coming into the counselor or for the psychiatrist, not at that time only we are assessing them, but during the follow-up procedure also we have to assess them, so we can understand whether they are developing or not. Okay. And lastly, aids in planning individualized nursing care. So this is why the mental status examination is important. Next one is explain the role of nurse in electrocognitive just give me 1 second. Okay, so what we are explaining, explain the role of a nurse in electroconvulsive therapy. Electroconvulsive therapy is by not using the drugs or not using the psychiatric behavioral therapy or something. It is actually a procedure, a medical procedure in which the small electrical control wave will be passed through the brain, or we can call it as current, also pass through the brain to intentionally trigger a brief of seizures while the patient is under general anesthesia. So what we will do, we will give some electrical shock to their brain to stabilize their nerves, or to give a small amount of seizure to their brain, okay, to control different kind of psychotic disorders. Okay, so main purpose is to highly effective, it is a very highly effective treatment also. It is generally used when the options like medication and therapy are not working. Okay, psychotherapy are failed to provide the relief. It can produce the rapid and significant improvement, okay, in severe symptoms, which is particularly important in life-threatening situations such as when a patient is actively suicidal. Okay, so what is the procedure? So before giving the electroconvulsive therapy, we have to obtain the informed consent. We have to ensure the fasting of 6 to 8 hours, remove the dentures, jewelry or contact lenses, because the dentures and any kind of jewelry or material item can increase the shock and it can go through the heart. And contact lenses should also be removed, because sometimes the electrical shock can damage the silicone product. Okay, then administrative atropine as prescribed, okay, it is act as an anesthesia, so the patient will not feel any pain. Okay, then provide the psychological support and explanation before giving the procedure. Okay, so this is the pre-ECT care. Come to the during ECT care, we have to assess the psychiatric anesthetist, maintain the airway, monitor the vital signs. We have to protect the patient from injury, use mouth gag. Okay. Then after the ECT care, what we can do, we can place the patient on the side of position, monitor the vital signs, check for the confusion and headache, reorient the patient after recovery, and document the procedure and observation. The next is describe the types of management in personality disorder. So personality disorder is differentiated into 3 types, which is cluster A, B and C. Cluster A, it is odd and eccentric, which is come under paranoid, schizoid and schizotypal. Cluster B is dramatic and emotional, which is antisocial, borderline histrionic and narcissistic behavior. Then cluster C, which is anxious and fearful, which is avoidant, dependent and obsessive compulsive. How we can manage this? So we have to as a nurse, we have to establish a therapeutic relationship, use the consistent limit setting, especially in the borderline or antisocial. We have to encourage the expression of feeling, cognitive behavioral therapy, pharmacotherapy and symptoms control, such as giving the antidepressant and anxiolytics. Next is discuss preventive psychiatry and level of prevention. So preventive psychiatry is actually focusing on the preventive mental illness, promoting mental health and early detection and rehabilitation. The levels are primary, secondary and tertiary. In primary, we will promote the mental health and prevent the illness. Example as stress management, parental guidance, school counseling. In the secondary, we will give the early diagnosis and prompt treatment. Example as screening program and crisis intervention. In the tertiary prevention, we will give the rehabilitation and relapse prevention. Example as vocational training and aftercare programs. Next is explain the concept and process of crisis intervention. So as we already told, it is actually a short-term goal-directed therapy used to help the individual to cope up effectively with the stressful event or emotional crisis. So first, what we have to do, we have to assess them, identify the nature of crisis and safety risk, then establish the rapport, build the trust and active listening, identify the major problems at the feeling of the person, develop the coping alternatives, implement the plan where we have to give the support, guidance and problem solving helps. Lastly, follow up and evaluation, we have to assess the improvement and need for further therapy. The next is describe the nursing management of a patient with substance use disorder. So a patient with substance use disorder such as alcohol, smoking or drugs. Okay, first we have to do the assessment where we have to identify the type and duration of the substance use, assess the withdrawal symptoms and motivation to quit. Then as a nursing intervention, we have to maintain a non-judgmental attitude, provide a detoxification care where we will monitor the withdrawal process, administer medications such as benzodiazepine and disulfiram, promote the nutrition and hydration of the patient, encourage group therapy, counseling, A or NA, educate about the relapse prevention and support the family improvement rehabilitation. This is a very important question. It will definitely come in exam. Okay. Next, we have some short answer. Define mental health. Mental health is a state of well-being with an individual realize with their potential can cope up with the normal stresses and life, can work productively and is able to contribute to their community. Then mention two characteristics of mentally healthy person. First will be has a positive self-concept and maintenance good interpersonal relationship. List two causes of mental illness, which is biological factor, example as genetic predisposition, neurotransmitter imbalance and psychological factors such as stress and trauma. Write two functions of psychiatric nursing: provide therapeutic care and emotional support to mentally ill patient, administer medications and monitor for side effects. Next, define therapeutic communication. What is this? This is a procedure where purposeful goal directed from the communication used by nurse to build a trusting relationship and to promote the patient mental health and emotional well-being. Then write two components of mental status, which is appearance and behavior and thought content perception. List two defense mechanism, which is denial and projection. Okay, denial and projection. Then two examples of mood disorder, which is major depressive disorder, bipolar disorder. Mention two type of schizophrenia, already told, paranoid and catatonic. Write two common side effects of antipsychotic drugs, which are dry mouth and extrapyramidal symptoms, which are tremors and rigidity. Okay. Now we will discuss some very important questions. Okay, this I have not maybe discussed in this, but you can go search in the YouTube for Easy Nurse. There in our previous years also we have already discussed it. If you want, you can go and search in the app, but this will definitely for 1000% sure it will come. Okay, so if you want to take screenshot, take it, or else you just write it down. Okay. First is what is electroconvulsive therapy? Short answer for 2 marks I am saying, okay, for 2 marks. What is ECT? What is the legal responsibilities of a psychiatric nurse? Mention 2 community mental health services, define crisis. These 2 are very, very important. Then write 2 nursing intervention for suicidal person. Define obsession, again important. Features of mania, again important. 2 examples of anxiety disorder. Write 2 characteristics of therapeutic nurse patient relationship. Mention 2 types of admission in mental health settings. Next, for the short essay of 5 marks, okay, what questions can come? Explain the role of a nurse in myelotherapy, very, very important. Describe the phases of nurse patient relationship, again important, okay, but this is the most important. Enumerate the principles of psychiatric nurse. Discuss the types of management of anxiety disorder, important. Explain the causes, clinical features, nursing management of depression. Just to know the what is mean by depression, you can write it down. Explain the mental health services available at community level. Discuss the role of a nurse in rehabilitation of mentally ill. Describe the legal and ethical responsibilities of a mental health nurse. Explain the family therapy and role of nurse in it. Describe the etiology and management of obsessive compulsive disorder, important, okay. So these are the short essay question that I have suggested, okay. Try to read that at least once, okay. Next is long essay question. So here, describe the legal aspect of psychiatric nursing practice. Define schizophrenia and describe its type, clinical features and nursing management. Define bipolar disorder, explain the phases, clinical manifestation and nursing management. Discuss the therapeutic nurse-patient relationship and its phases in detail. Explain the etiology, clinical features and nursing management of depression. It is important but not that much. Explain the nursing process applied to patient with the schizophrenia. Describe the management of substance abuse disorder, nursing care plan, and discuss the preventive promotive aspects of mental health in various levels, okay. So these are the long issue questions which will be coming, okay. From this only it will be coming. I can guarantee you from 60 to 80% of the question will be coming whatever I have suggested, okay. You can blindly trust on this, okay. Once your exam will come over, just come here, search for this, and you will definitely see how many questions have came common, okay. So guys, best of luck for your exam. I hope you guys all can attend your exam very nicely, okay, and get good marks and pass easily. So thank you for this session, guys. See you in the next session. Till then, keep learning and keep tuning with Easy Nurse. Thank you.